My name is Kate Blessing, and I work as our Community Relations Director at Martin Luther Campus in Bloomington. And we are an Ebenezer community and are very happy to work in the Fairview system and with all of you as our colleagues. And we really appreciate the partnership of our care teams in the hospitals in the work that we're doing to continue that care in transitional care, assisted living, and so forth. So thank you very much from the bottom of our hearts for all of your work. For those of you who might be new to our campus, Martin Luther Campus is a senior living community in Bloomington, and we've been around for 60 years. In fact, next year, 2021, is our 60th anniversary. We're starting to plan some things and COVID-friendly things to do during that time, but we're really excited. And it just really shows the many years that we've been walking alongside seniors and their families, and what a privilege that is to all of us to work in that way. And then we're so proud of the vast experience of our care team. We've got many folks that have been here 20 plus years at Martin Luther Campus. In fact, I have a colleague who just celebrated 32 years of employment last week, and that's not uncommon on campus. So I've been here 2 years, but I'm so impressed by the longevity of our staff and the expertise that they bring in that work. And so today, Martin Luther Campus provides assisted living and memory care, long-term care, transitional TCU care, and then our adult day programs. And just so that you know, we do have some immediate openings in our assisted living, ongoing openings in our transitional care, and then our adult day program is back up and running, and we have both an in-home option and an on-site option at Martin Luther Campus in Bloomington. So just to be aware of those things as you're working with folks. You likely have worked with my colleagues, Megan Shimmick, who is our Admissions and Social Services Director at our care center, as well as Amy James, who heads up Meadow Woods Sales and Marketing for our assisted living, and she'll be, of course, our speaker today. And what I love about both of these women is they have tremendous knowledge and passion for this work. They walk beside families. They're often some of the first calls that families make when they're trying to figure out what is senior care, what level do I need, how does this all work? And I just really find them to be really great to work with, and I'm passionate to work with them as well. And then for all of you, I see you all as a social worker. I think of somebody with a big heart, a big toolbox of resources to try to answer the many, many questions that you get every day. And so I just want to reassure you and to let you know that Martin Luther Campus is always a place where you can come for help. And so just be aware of that as well. And we want to be that partner with you always. A couple of housekeeping things. We will have a CEU certificate after today, so I will get that to Mary, and she can send that on to everyone, as well as an evaluation. So we always love to have your feedback and future topics you might be interested in. And then also, if you have questions at the end of the presentation, Amy will be taking those in the chat field, so you can add those along the way, and we'll go through those at the end. And so now I'd like to transition things over to Amy. So as I mentioned, today's presentation is on navigating senior care normally and in COVID-19. And we're really fortunate to have Amy as a speaker today. She's someone that's a colleague of mine that I love working with, and she has vast experience in assisted living, memory care, understanding those care levels. How do you pay for things? What questions do you ask? How do you explore all of this? She's often that first call, as I said, to people, and she so beautifully does that and asks always, you know, what she thinks about it in an empathetic way, which I think makes her a great salesperson and a lovely person to work with. So the last thing that I want to tell you is also that she has been working in marketing and sales for 20 years, just about 20 years, and the last 4 has been at Martin Luther Campus, and also has a senior living and marketing sales certificate from Leading Age. So she's highly qualified, and I really can't sing her praises enough. So I'm happy to turn things over to Amy and have her start here. And I'm just going to admit a few more people in. Welcome if you're just joining us. I'm Kate Blessing. I'm just going to share my screen here, and then we'll let Amy take it away. So, okay, without further ado, Amy James.
I'm just going to jump in. Ebenezer is our parent company. It's over 100 years old. Martin Luther Campus has been around since 1961, so we do have a breadth of knowledge between us, but also around us. So the things I'm going to share with you: when is the right time to plan a move? What senior care is available out there, and I'm going to describe levels as I describe them to people walking in my building. who are looking. So you'll get to hear how a salesperson describes this. How much does it cost? How to begin the search, what to look for during COVID-19, and what other things I should be thinking about related to COVID-19. I just want to note, we know you are the people who are meeting with these residents and families at the time when they most need to be thinking about a move. And for that, you are superheroes. I know you went into this business because somebody told you you're a good listener and you should go into healthcare, and you're so good at this. And it's hard. I know how hard it is during COVID, and we know the work that you're doing and are so appreciative. I hope any salesperson you call is helping you out big time, because we want your calls, and we want to be the person that you're handing off families to if you need to. So thank you for what you do. When is the right time to plan a move? I always tell people, plan now. Just start. Have a plan. Have a backup plan. Put them in writing. Tell your healthcare agent or your power of attorney. Start setting those things in place. And then here's some things. I'm usually meeting with the daughter. So this is what I'm telling the daughter. When you see your mom and dad, what do they look like? Is their health kind of deteriorating? Are you looking at them going, wow, I didn't remember she looked like that? Is it taking longer to recover? Is a chronic condition they've always had just getting in the way of their regular life? Extreme, I would say, weight loss is what we normally see, not weight gain. They are not eating correctly, usually at home. It's increasingly difficult to participate in things, do the things they used to do. Maybe they can't golf anymore. Driving, of course, is one of the biggies. Social life isn't what it used to be. So where a person might have had hobbies and interests, they are now watching a lot of TV or doing a lot of window watching or doing a lot of, you don't know what they're doing anymore, but they're not reaching out to friends. They aren't doing the things that they used to get enjoyment out of. And that change is significant. Nutrition is failing. I always tell the daughter, what's in the fridge? Is it filled with expired food? Is it not? Is there nothing in the fridge? And then what are they eating? Is it all microwavable, or is it she's getting by on toast and Cheerios? So then kind of understanding the nutrition level a person is at. The maintenance of a home is obviously another clue or indicator about what a person can or can't do anymore. Has it become too much? And really with that, the maintenance and some of these other things, has a care team of siblings or children been able to be put in place or not, and how is that working? So those are all kind of the parts I'm looking at, moving things that I ask a family to start thinking about, and to always be ready for a move if you need one. I think the hardest scenario I come across is we have a couple in a home, and one has dementia, some memory loss. There's a caregiver, and it's the caregiver that goes to the hospital. And then it's a mad scramble for that person at home with, a daughter coming in to care for it. And then they're trying to find care for both at different levels of care. And that is the most complicated thing to work on. And I know you know that. Okay, so I'm just going to walk through the levels of care as I explain them, so you kind of hear, and I'll try to point out COVID trends while I'm doing that. So independently, kind of describes that lifestyle of I'm doing everything for myself. But in particular, in terms of the housing stuff, condominiums or cooperative buildings that are designed for this are usually 55 plus. You are purchasing it, so you're buying into it, and then you have to sell it on the backside, and there's usually a month-to-month cost with that as well. So it's different than assisted living. So usually there's some other extra special things about the building that might include some amenities or wider doorways for someone who might have a wheelchair at some point, but convenience things, maybe door handles are the handicap, accessible, easy kind, or there's some things that are better about, underground parking would be a benefit. There might be a beauty shop also in an independent living. The costs for independent living are really market rate costs for apartments. So it's going to be like that $1,500 to $2,500 per month. And that's after you've already bought into it, which is kind of weird. I know, I still don't quite understand cooperative living either, but then you buy into it, you sell out of it, and it's the benefit of being able to turn the key and go to Florida for January and February. And once someone told me that, I got it. I understood. Oh, secure. exactly usually 2 staff people in an independent living. So I'm going to talk about staffing with each one of these also. Just the cost in staffing really helps you set apart the levels of care. There is no care in independent living. The 2 staff people would be a housing director signing the agreements to move in, or the leases, or whatever the arrangements are for that. And then a maintenance person, and then maybe a part-time housekeeper for the common areas. But in an independent living, everybody's kind of doing everything for themselves. They might themselves organize, have a council board where they're doing some things together, a meal or 2 a week, something like that, where it's they either purchase it, or it's maybe a potluck kind of a thing. The trend for, I think, independent living is people are staying put. They're going to stay in independent living as long as possible, because right now, independent living places are not regulated for who can come in and come out. It's probably just the building deciding how safe it is for people to come in and come out. And certainly everybody would be wanting to mask and 6 feet apart in the building, just like we do at the grocery store at Walgreens or anywhere mandated in our state, you know, and what's good advice for that. But this doesn't really fall under MDH restrictions. So independent living. Okay, assisted living. I'm going to spend some time here. So this is housing with services. They are month-to-month leases with a 30-day notice. And the cost is always a rental rate, and then there is home care. So the rental rate is going to be usually twice the price of a market rate for an apartment. So I always describe it to families, it's an apartment building first that happens to have staffing, you know, for your loved one to stay as independent as possible for as long as possible. So with that rental rate plus the cost of care, generally speaking, I tell people plan for $4,000 to $7,000 a month. If you're trying to project out a few years and what does my mom have left, $4,000 to $7,000 a month. And of course, that's kind of a big range, but that would help you certainly kind of create a budget. So during COVID, what we've seen is certainly a slowed down move-ins, a couple move-outs because daughter wants to see their mom more often. So that's been kind of the COVID trend. But assisted living is you receive meals. So in that higher market rate place, you're getting meals, you're getting housekeeping. At our building, we do some laundry for you. We provide sheets and towels. And then the home care that happens. You get a pendant when you move in also. So it's like a call button to the staff, which are in the building 24 hours a day. Assisted living has no furniture provided. So they are empty apartments. We don't provide hospital beds. We don't provide any type of equipment. We don't provide the lifts for anything in the bathroom or bars. We can install if someone purchases them. And certainly you can bring in whatever kind of bed you want. So if you'd like to have a hospice bed or some special bed, you sure can, but you buy it, you bring it in. So in terms of staffing, I always like to highlight staffing. So in our assisted living, it's about 70, 80 residents, and there's 2 to 5 nurses on Monday through Friday, 8 to 5 p.m. There is 1 nurse on Saturday and Sunday from 9 to 3-ish. And then for our RAs, the kind of ratios for 70 to 80 residents, we have 4 RAs on from 6 to 10 every day, and 2 on from 10 to 6 in the overnight, 10 p.m. to 6 a.m. in the overnight. So there certainly is staffing in the building, but it's very different from long-term care, nursing home level care, which I'll get to. So I just wanted you to understand that difference. When someone needs assisted living, I will say right now during COVID, really what's putting people into assisted living is a health event. They have a health event, something's changed, and they can't sustain where they are right now, or their family can't sustain them where they are right now as caregivers. Another thing, I'm suddenly no longer driving. This is an environment where your meals are brought to you, housekeeping is happening, your meds are delivered and we're giving them to you. So there's not a whole lot of reason to leave, which is great, especially during the middle of winter and during COVID. So it can be this kind of bubble, a contained bubble environment, which can feel very safe to the residents who are already living there and have enjoyed this environment, their friends are still there. They see people. We're doing the masking and 6 feet apart, you know, as we walk around the building, but they are not isolated and alone. So let's see. Discharging from the TCU. I want to say these are the fastest and hardest decisions I think families make. So if suddenly someone is at a TCU and they need to look at assisted living and they weren't expecting it, that is one of the hardest things. And during COVID, let's just put some more heaviness on that. So this is a hard time for people who have that experience. On the backside, I always tell people when they're considering assisted living, particularly if they're in the TCU, you are only signing a lease. It is just a lease, and it has a 30-day notice, and this is pretty standard of most assisted livings. So let's say you're at a TCU and you want to go home. I just don't know if I can. I need to prove to myself, or my family needs to know that I can get back home. Use the assisted living. Move in for a season. Move in for 6 months. See if you like it. See if you don't like it. And when you're in that, you know, I have to discharge. We've got 5 days. I got to go somewhere. I can't go home. It can be temporary. I think people think, oh my gosh, I'm making this decision for the rest of my life. And it doesn't have to be that way. It will require your family to move you and furniture if you don't like it or something. But all these leases have 30-day notices. And I just try to impress that on families to take the fear out of it. The other thing that helps take the fear out of it for the resident or for the future resident is if they have some decision-making power about their home, the things. So I tell daughter or son, you know, give them as much choice as possible. Well, do you want to move into this assisted living or this assisted living? Do you want the picture from the living room on that wall, or do you want the one from the bedroom? What would you rather have, you know, this or this? And so that they're feeling like they have power along the way. And maybe leaving it open. We'll try to sustain the home if we can. So in a couple months, we can reassess, and we could give a 30-day notice and get you back home if we feel like we can do that. So I think that's giving the choice is really important. Memory care. Memory care, of course, is often in an assisted living building. There are standalone memory cares right now, of course, that are wonderful. I would say those are the best memory care places, are the ones that are standalone because they have enclosed outside areas. But if you're tied to a particular town or community, you know, there's almost every assisted living has a memory care in it. And this idea of progressing from care, if someone moves into assisted living and kind of know they're going to need memory care, then it's helpful to have that in the building too. So memory care is a secure wing of a building to prevent wandering. That's basic what it is. It also has an increased staff level. So the staffing in memory care is 2 to 14, 2 RAs to 14 residents, so 1 to 7, from 6 a.m. to 9:30 at night. And then there is 1 to 14 in the overnight. We also have an increased activity staff, though. So there's 2 to 4, I would guess, in any most memory care pods. Memory care is also divided into smaller. So maybe we have 42 memory care apartments, but they're broken into 3 sets of 14, kind of a pod, so that the staff are kind of committed to a pod. The activities staff are coming to that area with a common living room, common dining room. So they become a community unto themselves, which can be very helpful if someone has memory loss. So I don't have to remember all the people, I'm remembering just this group. And it makes for spaces that are smaller to navigate for someone with memory loss also. I want to define when someone is moving in and they don't know if they need assisted living or memory care, and they're kind of on that bubble. I want you to hear the questions that I will kind of just pose to a person. I will ask them, does your person wander? Because if they yes, that's happened, then we need to talk memory care. If they have not wandered, then we could maybe work with assisted living. The idea is to keep people as independent as possible for as long as possible. So not to layer on the care if you don't need it, but to keep them safe. So if a person is good with routine and they're not wandering and they enjoy their own company, that's a good reason to stay in assisted living until you need memory care. My nurse kind of developed the question, would this person be safe behind their own closed door in assisted living? So if someone has memory loss, but in their own apartment, they would be safe. And by that, I mean, they would remember they have a pendant on. So if they fell on the floor, they could push the pendant, or they might remember, I can call 911. I know how to use the phone still. I can call 911, or I would remember there's people around and I can call out. I am not truly alone. So if a person has some of those things in place and enjoys routine, so they aren't doing the sundowning, night waking thing, then assisted living can still work for a while for that person. What I mean by safety behind your own closed door, I'll just give an example of a real example of what happened. There is a large array of cognitive ability in our assisted livings, in all of them these days. And if a person can make it and be independent, we want them to be for as long as possible if it remains safe. So we had a gentleman who was living in our assisted living and seemed pretty good. He would sometimes forget which door was his to get back to his apartment. So beginning indicators. But he had friends who were helping him, his neighbors. And but we did find at some point he decided to clean out some of his clothes in his sink in his room. Also fine, great, do what you like behind your own closed door. But he was drying his wet clothes on light bulbs, which our housekeeper found scorched and clearly would be a fire hazard. So then that turned into a very quick move into memory care. So behaviors like that, you know, where the cognitive problem solving reasoning has not been shown, or has been shown not to be there anymore, would be the reasons for a move like that. Cost. So cost is still in memory care a rental rate, which would be that twice the market rate of a regular apartment, plus it would be a care cost. And a memory care cost is usually a package rather than just paying for a shower assist, like in assisted living kind of a thing. So generally speaking, it's $7,000 to $10,000 that I tell people to budget for. You could be on the underside of that if you're in a very small studio kind of a thing and you need a low level of care. But if you're in the largest apartment in a memory care place plus the top end of care, it would be probably right around $10,000. Reasons to move someone into memory care. My most recent example was there was a family that was really committed to keeping mom at home, and they were staying with a mom and dad and kids that were in school. So dad is a teacher, and he's trying to navigate this online learning that he's got to create for his students. The mom figure in the equation got a new job. She had been out of work. She found a job, and the kids are now going to school online. And grandma is in the house, and her memory is declining, and they need more and more time spent with her, even though they're all getting pulled out because they're distracted. So it became an unsafe environment and not something that this family could sustain any longer, even though they were committed to keeping grandma at home. They did not want to move her in. And finally, they just got to a point where, as caregivers, we got to the end of the rope. And when that happens, particularly with memory care, it can be really hard for people to let go. And particularly for memory care, I think when a family allows a facility to take care of their person, that previous daughter or spouse can be back in right relationship with their mom, dad, or spouse. If they've taken on the role of caregiver, then they've lost something in what they used to have. And then when they give their person to us and we become the caregivers, then they can just be back to loving that person, loving them up, and bringing gifts and singing to them or whatever they used to do, and let us do the caregiving. So that always feels good when someone does trust us and honors the process and tries to honor their person through it, and we are too. So that's been good. Even during COVID, we've had those move-ins because those things are happening. So the trend during COVID is memory care is filled. Assisted living, not so much. So also wanted to note this too. In assisted living, we've seen some move out, not many move outs, but a couple move outs, and just people hesitating to move in. We've also seen the population that lives with us healthier, which is interesting. So not as much flu and other weird stuff that normally goes on. So they are staying healthier and alive longer, which is interesting, because we don't have outside influences coming in. So our occupancy has kind of just been maintaining, and which is good. And we get the occasional move-ins, which is good. Some places have been hit harder in terms of the move-outs. But anyway, just wanted to note on that. Care suites and enhanced assisted living. Now, not every place has care suites and enhanced assisted living. What that means, though, is an assisted living took a little part of their building and took a few rooms that kind of were maybe close to each other, and they put a nurse and an aide that are particularly for that group. So it is almost like long-term care in this one area of an assisted living building. So these would exist in a standalone assisted living building, so a person doesn't have to move to long-term care. So care costs would be likened to probably memory care costs, in that probably $8,000 to $12,000, kind of approaching long-term care costs. At this time, I don't know. I don't have care suites or enhanced assisted living in our building. Right before COVID, I was finding, when I needed to refer someone, I was finding them harder to find. So again, not every place has them. They are a little tricky to find, and I think they do fill. So, it's tough to find those spots. I'm going to jump to nursing home and long-term care. You all are probably a little more familiar with the nursing level care. Cost, you probably know, it's $400 a day approximately, so it's about $12,000 a month. I always say if someone is approaching that in an assisted living or a memory care, or you're approaching that $12,000 with home care, you might want to consider a move to a higher level of care, just because that's an indicator, I'm just going to say the general public does not know that long-term care, skilled nursing, and nursing home and care center all mean the same thing. They come in and they're asking about assisted living and care, and they usually call any care long-term care. And so I try to do my best to define what that means, but it's really confusing for people out there. And most of them have really not great memories of what that nursing home level care means. So kind of overcoming some of that is a lot of what I will do with people if they're asking about it. The general public is also confused about cost for long-term care. So we know it's the most expensive care because you've got the most nurses and the highest, resident to staffing ratios there that are really great. But for whatever reason, a lot of people have a misconception that a nursing home would be cheaper than assisted living, and I don't know why. So, but it's interesting. A nursing need. So the thing I do spend a lot of time talking with people about it, if someone is at the highest level of assisted living level care, so they're wheelchair bound, they need a 1 to 2 person transfer, and they are getting on the complicated side. The thing I always ask the family to consider with the resident is, yes, you can move into an assisted living, most assisted livings at that level. So I've got a gentleman in our assisted living named John, and he's had a stroke, so he's lost the use of half of his body. He's in a wheelchair. We are helping him transfer for everything, helping him in the bathroom, helping him bathe, dress, groom. We do some cutting up of meals, and modified diet kinds of things. So we can do that care. The question is, if someone is moving in at that level of care, they might not stay in assisted living for as long as you would want them to. So kind of thinking about how many moves do you want your mom to make? And I just think that's a really important question. And what's happening during COVID is people are staying in their homes longer. They're trying to make it work for a lot longer than they would have, and trying to wait out the COVID. Like, I don't want to move, Mom, until we see a vaccine or till we know we can visit, or whatever those questions are. So we are seeing people at that higher level of care, more memory loss than less, kind of moving in, kind of because they're waiting it out. So it's just, how many moves do you want to make if you're coming in at that top end of care? Certainly, because of our staffing levels, if you probably know, an assisted living can't have every person in their building be at the top end of care. That just wouldn't work. We wouldn't have enough staff. So assisted livings are always balancing that kind of from an insider point of view too. So what I tell families, when would my mom need nursing care? That's the question I get. So I always say, if there's a nursing need in the overnight, in assisted living, we don't have nurses overnight. They're on call. If it's complicated, if there is actually a skilled nurse that needs to understand these very specialized medications, and needs to be giving them overnight, and an aide can't do that. LVAD. So at our care center, we can take folks who are on an LVAD. I had someone call just in the last couple of months who really was lightweight care, but they had the LVAD, and we can't care for that. More than 4 safety checks a day, once we get to, or night, so we can, go in and just, let's say someone's doing some night waking and they just need the assurance that someone's there. We can go in and, pick up to 4 times a night is about our max. But if we're going in every other hour or more, that would be nursing level care, or vitals every, more often than just a couple times a night. Then we're getting into that nursing home level care. And certainly, the one other big indicator is if a person can no longer bear weight on their feet. That's another big reason at our location we would move someone to long-term care from our assisted living. We have a Hoyer in the building, we have easy stands, but when you get to that level of care, you're at the top of our care, and they just would probably be more comfortable. The bathrooms are set up in long-term care in such a way that it's going to be easier and just more dignity and some of those things. Because of the staffing levels, I want to bring up one other thing. There are personalities that prefer to be alone. So, I need a lot of care, but I still want my own apartment, and I am not going to ask for too much. I will just, I need the care I need when I need it, but I just like my quiet, or I like my radio. And then in assisted living, we have people who get to that higher level of care, and they really need to see someone, like a lot. They need that attention and just the assurance that someone is around. And when we get to that point too at the assisted living, that's also in long-term care, kind of comes into play. And sometimes for long-term care, that they'll look at the person and say, well, aren't they kind of assisted living level care now still? It doesn't look like they may be, but they need so much of our staff attention that assisted living, we can't provide that. If we spent the time they need, if we spent that time with them, we wouldn't be doing what we need to for everybody else. So I just want to bring those things up. So I think you probably know more about skilled nursing and long-term care during COVID right now. I think it's been ebbing and flowing based on who's in hospitals, and you probably know that better than anybody. So, that's been ebbing and flowing. Staffing, for long-term care and TCO, just kind of FYI, it's kind of a 1 to 10 ratio, and with 1 to 2 aides per 10 to 12, which is higher staffing than memory care. And that with all of these, there's activity staff as well, and spiritual care, particularly at our location, that gets involved too. So moving on. So how to begin a search. Decide what's most important to you about a facility. Location, proximity to family is usually the biggest one. And there's some other things I listed, but also like something specific. You're looking for a 2-bedroom apartment, first floor, balcony. That's how to begin making your list. Figuring out what kind of care you need. And this is where what I just described to you, I'm walking people through. Well, does mom need assisted living or memory care? What is the difference between long-term care and assisted living? Those are the top 2 questions I get when we're trying to figure out what kind of care. Knowing your financial situation and budget is certainly important. What other family members need to be with you. Be aware to address your own emotional process and honor it. So this is something I think takes even the hardiest Norwegians by surprise about how difficult it can be and the range of emotions they are going to go through when they begin looking. On a tour, I have families mad at each other. On the tour, I have people crying. It's kind of all over the place. But this is an emotional process, especially when it's fast and when it's during COVID. The biggest thing for choosing a facility, I think, besides cost and care, is the care going to fit and all that, is how does it feel? So when you walk in a facility, does it feel like home? And it's just like visiting a college campus and, oh, this is the one. Or you're looking for a new house and you walk in and, oh my gosh, this is it. That's the way that's the way people choose them ultimately, once they narrow down the couple that are going to work for them in the location or type of care they need. So questions to ask. Now and before COVID and now, they really haven't changed. Is there a waiting list is a good question. I will say everybody's maintaining wait lists, but they've kind of been thrown out the window because, I mean, you keep the wait list and we're all going through our wait list. Hey, you ready to move yet? Well, no, I'm going to wait. But the waiting list, they're really waiting now. So, but people still should wait lists because I feel like I see a time coming when COVID kind of moves past or when people get to their wits' end, and we are going to see people moving in at a higher rate when people feel safe to do that. The number of moves needed to change healthcare needs, like I was telling you, like how many moves you want to make, depending on what care they need. Deposits, there's always a cost to move in. That's a deposit. It could be as low as $1,500 where we are, but it could be $2,000 to $3,000 or even 1 month's rent. The process, the period of time until move-in is usually 1 month. So when you are within 1 month of move-in, that's the time to make a deposit. Certainly if you're in a TCU, getting on it just right away so that you're ready to go. What's the notice period if I want to move out? In most cases, 30 days is that lease out period for assisted living. Can I bring in my own help? With COVID, yes and no, right? So essential caregivers, if you can become one of those, then yes, it'll be very guided with the times and days you can come in. Normally, we would be doors wide open, but right now it's a little different. I'll get into that in a second. And then always know your costs and rental rates. The thing I always want to tell people too, if they're considering this, particularly for their parent, the average length of stay in care nationwide, this is a statistic, is 18 months to 2.2 years. So when you've gotten to the place where you're not driving, I need someone to help me do something in my life to get through the day. You're at a place where the body's breaking down. So while some people certainly move into care and live there longer, the average is 18 months to 2.2 years, which is just a reality check. And sometimes I do share that with families that are looking at costs and I see that their parent is at the very highest level of care, and I'll just sometimes share that statistic to kind of, okay, when we're at this place in life, here's some check on that. Here's a reality check. Common questions during COVID. Right now, can I see my mom? Biggest top number one question we've got. I need to move mom in. It's happening, but can I see her? So every facility is measuring this a little differently. Outdoor visits are scheduled outside and usually a half hour or less with a staff member. And they're cleaning the surfaces and everybody's masked and staffers are shielded and sanitizing and making sure that nobody's touching or hugging. So yes, you can see your mom. Most places are utilizing technology, FaceTime, or other apps, to schedule that with residents and their families. And then there is this essential caregiver role if you qualify. Usually one person for each resident is being identified in a lot of cases. We are more conservative right now, so we are only letting we are calling people our essential caregivers at our location who are actually coming in to actually do something. Laundry, medication management, something that is, and it could be an emotional need too, but that there is something very specific they're doing. So with this week's news, I think our essential caregiver roles might change for everywhere. They might be opened more. Outside visits are going to end with the cooling air. So, these questions I get during COVID-19 are shifting, I would say, every 2 weeks. I might have a different answer for how this comes in. So people just have to keep asking, what's it like now? But the idea is we don't want you to disconnect from your family, so we'll do everything we can to help you connect if you need that. Can my mom leave her apartment? Yes. If she wants to walk around the building, the whole building is her home. There are places in most assisted livings that are common areas. 6 feet apart with a mask is still the way we live inside the building. Beauty shops have reopened for the most part, unless there's COVID in the building. And then dining rooms are opening. So there are common spaces we are using now. Will residents and family be notified if there is COVID in the building? Yes, within 24 hours. Will residents and family be notified if a staff person with COVID is in direct contact? Yes, absolutely. Oh, I missed one. Have you or do you have COVID in the building? I think this is a really critical question to be asking. If you're looking for a place to move mom or dad in, to know if a building has had it or hasn't. And I'll tell you our story. So Meadow Woods Assisted Living had 3 cases. March, I think it was like the 15th, 16th, and then we quarantined the building. It was in one particular memory care unit. We had 3 residents, and they're all over the age of 85. They were all in memory care. They are all still with us, and they all recovered, and we have not had a resident case since. I think it's sufficiently scared the staff and all of us. We are well-versed in how to use the PPE. Washing, sanitization of every knob happens 3 times a day. Our protocols were on guard early on, and I think we've stayed there. So kind of knowing the story of a building and the leadership and what's happened at a building can give you a sense of they've made it through this, they've gotten to the other side of this, or if they're currently in it and they haven't gotten out of it. You know, we've had a case consistently for 3-4 months. That's a different answer to that question. So confidence of the staff is I think really what that is about, though, and confidence in the care you're putting your mom or dad into. Like I say, I believe still that assisted livings can be kind of a bubble, and I think we have been at Meadow Woods, and I think you can get to a place where you are that bubble. Certainly it can be brought in, you'd handle it, and then you get back to being that bubble again. So it can happen, and I think it does happen at the good facilities. How often are residents and staff tested? Right now in assisted living, memory care, you know, any senior care facility, we're doing 20% of residents and staff every week. So I was getting tested about every 4 to 5 weeks. When we've had an asymptomatic staff recently, so then all the staff got tested and the residents. So we did all building, you know, once that happened. And then of course the staff person's taken off of the schedule right away. In long-term care, I know next door at our sister property, it's 100% of staff and residents every week for the last month or 2. And that has just depended on probably what facility you're at, how often you're doing that, or for how many. So that's a good question to be asking. What other precautions are being taken? So screening of all staff, I'm sure you're doing that where you work, but you know, do I have symptoms? Checking off every morning when you come in, having your temperature taken and someone else is signing off for you, wearing the mask, wearing the shield, sanitization of the facility, washing your hands, you know, so all of those things. But asking a facility and having them verbalize, that's important. What's the facility doing to support residents socially and emotionally? There are still activities happening. In fact, right now, activities are being added. So that's happening. Our spiritual care staff has not stopped doing worship, has not stopped visiting with people with PPE. Does the facility have all the PPE they need? So very good question. We're Fairview. I think we all feel confident, which is great. Where am I at for time? Okay, how to shop and move into a senior living community during COVID. So shop online and only visit your top, 1 to 3 locations. No location wants anyone kicking tires coming in for a move a year from now. So we want you to do as much homework as you can before you get to us and before you're ready to move in. The Ebenezer standards say we don't want to tour anyone unless they're 2 to 3 months or 6 30 to 60 days within a move-in. And, I just lost it. Okay, so help me out. Yes, okay.
60 days, yep.
30 to 60 days, yes. So we don't want to tour you unless you're 30 to, oh yeah, and then how many people can come? The resident can come and one support, or just the support person, and they make the decision for the resident. That's it, okay. Take a virtual tour. Most places are offering virtual tours, have something that you can look at online as if you're walking through the building, ask lots of questions that we just went through by phone, ask if there's COVID in the building, find out how a community is organized for those visits that you want to make and family coming in. And again, that's an ever-shifting thing, depending on if there's COVID in the building or not. Find out what's available for dining service. Most dining rooms have opened for at least one meal with like two people at a table and plexiglass in between them, and it is hosted. We're seating people so they aren't talking to each other and stopping and visiting and touching and that kind of thing. So it is hosted. They're wearing masks until they sit down, just like a restaurant would do now. Move in and move out guidelines are more restricted right now. So when a resident wants to move in, they are given two movers, like 2 men in a truck, 2 family, and in 2 hours. So that's how fast it's happening. And then you move they're in and family has to leave. And that's how it is for the moving out. It's the same in reverse. Again, know the policy of the facility to give notice for move out. I don't think anything has changed during COVID, but there may be a facility that has changed. Ours is still 30-day notice. And then that wait list for future move-in, I still think is a good idea, even now. So the benefits of a move-in during COVID, I just wanted to share these quickly too. Choice. There's more styles of apartment to choose from right now. So if you're looking for something specific, you want to be on the first floor, or you want a really big apartment and you want the smallest studio, those are more available right now than they would normally be. Sometimes assisted livings during regular times are full capacity and you're just waiting for anything to come up and you have to take the next thing that comes up. So, but there's choice. Move-in specials I've started to see happening. Kate and I are both have been noticing, the first month free, or move in now and receive kind of an offer right now. So those are happening. The interaction, this is a big benefit, but the interaction of the staff and the residents that you would see daily may outweigh the being alone in your own home. And I do still think that's the case. These activities calendars, as I said, are adding things at this point during COVID-19. Dining rooms are opening, and we've opened the lunch service, and we're ready in about a month and a half to look at dinner time dining also. So it's, the more we get used to the safety of these things, then the more we can keep adding back in. And those things are going to keep flexing, right? So senior living environments are largely contained. I talked about that bubble versus someone who is going out to Walgreens and the grocery store and the bank and getting gas and it's probably safer in an assisted living ultimately than it is if you are doing some driving and you're out and about. Okay. Care support to stay at home care, you know all about that. I would say when costs of home care start to approach assisted living costs, it's time to think about a move. Sometimes home care doesn't work for people. They see the home care person as someone they have to entertain, which I think is funny because I know I'll do that. Or they'll see someone as, a stranger in their home, and that can be, so sometimes home care works, sometimes it doesn't. Adult day is still a way to go for someone who needs that. We've got our adult day open on our campus. Some are open, some are closed. So we heard the VA is not reopening theirs, but there are some open. Stay by the day, it would be a short-term assisted living. So staying in an assisted living for 2 to 4 weeks. We are not doing that right now. There are some, I believe, that are. So that's just calling around to find out if they have it. Paying for care, there's 2 ways. You always have to use your own funds first. That's private payments. Medical assistance is something you apply for when you run out of your own funds. I just have planning documents in here. I think you're aware of these. These are the things that you want to have in place prior to moving in that an assisted living would need when you move in. This is my favorite slide. No way, we're not moving out. So I think having clear goals, asking the resident, the future resident, like, what are your goals for your life? How do you want this to go? What are your wishes? And, having family try to honor those wishes, right? But if I have a resident who's, I'm not moving, and daughter's like, you have to, I can't care for you anymore. I do take a moment to look at the mom or dad, and I tell them, don't expect of your daughter what she can't provide anymore. Be in right relationship. I think that's really important. Don't frustrate your children. Don't leave this world with a broken relationship. That's really one of the most important things if someone is just not going to move. Exploring home care providers, private duty RNs, of course, is an option. Lifeline, other technology. I think technology is getting huge right now. We have a woman who is very vision impaired, and her family set her up with Alexa. She just has to tell Alexa who to call, and it'll make the phone call, or what channel to change it to, or to tell her a joke, and it's great. The medication systems that deliver medication are great. Utilizing grocery services, of course, curbside pickup and Amazon and Uber and Lyft, and removal services for snow, and there's all kinds of things to hire out if you want to stay in your home. Understanding hospice, I think, is a big thing. Of course, there's whole presentations on that. And then the resources available, I kind of have as the last slide. That would be more for, to refer someone out to if they needed something. I have lists for all of these if you would ever need senior real estate specialist or move management specialist. That's the kind of thing a salesperson does have. So thank you for listening. I hope this was something you got at least a new piece of information out of. Do we have any questions?
It looks like someone was wondering, can you speak to a family in regards to waiver and what that covers and pertains to in assisted living?
Yes. So the first thing I always say is, if you're looking for EW and when you're calling, you need to just say up front, I do take EW. So that's the first thing. Number two, I always tell a person, you can apply for EW when you get to $10,000 or less in total assets. That's when the county is going to look at your application. And then EW is, you're filling out a medical assistance application. So it covers your medical costs. It covers the cost of care. There's always still going to be a rent, no matter where you go. If you find an elderly waiver spot right now, the rental rate on EW is $934. So does that answer? Okay.
Okay. Can you please mention again range of monthly expenses for
independent living? Independent living it's usually like market rate. So the monthly cost for that is, what an apartment would cost in Edina or what an apartment would cost in Richfield. So they'd be comparable to kind of market rate apartments. So I have 1,500 to 2,500, depending on how big the apartment is, might be more than that. Any other questions? That concludes what I have, and it is just about 1 o'clock. So we thank you for joining us today, and thanks for being a part of our network. I appreciate you, all of you. Have a good one.